In this video, we're going to review how to do a discipline discharge. This should apply to physical therapy, occupational therapy, or speech therapy. So the first thing you do is check into your note and enter your time in. Then you're going to address incident report. If there's been an incident like a fall or an emergency room visit since their last visit from any clinician, you'll click yes and report that incident. If not, you'll select no. You'll then need to select your patient identifiers and select that the patient tolerated the session well and standard precautions were observed. If the patient did not tolerate the session well, make sure you document that elsewhere, but you do need to select this item to enter your note. Next, you're going to enter vitals. As always, if vitals are outside of parameters, you're going to need to call the doctor and document that you called the doctor and any new instructions from the doctor. Next, you're going to select your discipline. Now, if you are discharging early for whatever reason, those visits that are scheduled for future dates will show up here, and you'll need to select cancel schedules. Don't forget, if you are discharging early, you'll need to have the patient fill out a non-knock or a notice of Medicare non-coverage, which can be found in the patient's folder, just alerting the patient to the fact that they're being discharged earlier than initially planned and why. Moving on, care coordination. You'll want to document whoever you spoke with about your discharge. So, for example, if I spoke with a speech therapist, notified them that we were going to be discharging, I documented here that the speech therapist plans to continue for another week and will complete the discharge oasis. You can also enter any comments here about communication you've had with a PTA or CODA about discharge. Those are important things to include. Next, we have our reason for admission, what the patient's hospital stay looked like if they had a hospital stay, what their complaints were at evaluation, and what their goal was. Summary of care, brief summary of how the patient participated or tolerated any falls or incidents, and if they've made progress. You don't need to enter an essay for any of these, just a brief description. Condition at discharge, again, a brief description of the status of their goals and function at the end of your episode or at the end of your visits. Reason for discharge could be the goals were met with home health, or the patient was non-compliant, refused further care, or that the patient met their maximum expected potential with home health. For evaluation of goals, you can enter C goals to avoid repetition because we're going to address the goals later under the goals tab. Discharge planning, it might be that the patient is to continue with their safety recommendations and HEP following discharge, or in this case, the plan is for them to go to continue with outpatient physical therapy for higher level gait and balance training. Comment on any communication with the physician about this and any assistance you gave them planning. Next, written instructions given to the patient and clinician or by the clinician. You'll want to select yes, and for every discipline at discharge, you'll need to complete, review, and then have the patient or their caregiver sign a discharge instruction form. Those will be found in the patient's folder. You can make sure you leave a copy for the patient, and you can either have them sign a second copy, or you can upload with a scan from your phone of the discharge instructions to the documents for the patient's profile. That way we have a copy and the patient has a copy of those discharge instructions. if you are a contract clinician, you can just leave that form in the folder, and the clinician that does the Discharge Oasis will take the screenshots of all the forms and upload them to the system for you. But you'll want to make sure you review that form with the patient and have them sign it. You'll also want to select yes for patient. Clinician demonstrates understanding of the instructions. Then we're going to come down here to care coordination. Don't forget about these quick texts. So therapy recommended documentation will guide you through kind of what we're looking at for a summary of your discharging, why they're discharging, is the patient aware and in agreement with that discharge. Also, in addition to this, you're going to want to enter if you have a PTA or a CODA that was seeing the patient in previous visits, you'll want to make sure you enter a therapy assistant supervisory note. So you'll click one of these quick texts and you'll answer the questions appropriately to qualify for a supervisory visit. Then before we do our digital signature at the bottom, we're going to go back up to the top. We're going to go to interventions. There will be a button here where you can perform interventions, and then you can comment on each intervention that was performed during that discharge assessment. You'll also want to make sure you discontinue that intervention. There'll be a checkbox you can select over it, no longer needed / goals met. Then we're going to go to goals. You'll want to comment on the progress and status for all of the goals, and you'll want to identify if the goal was met or if max progress was achieved toward the goal. Any additional information about why the patient didn't meet the goal, if they didn't meet the goal. Now, whether the goal was met or not, you'll want to select goal met just to discontinue the goal. And then, of course, we'll go over here to forms. This is where you'll add your new form, your Wong-Baker pain assessment, and you'll also want to do the COVID screen as well. And any additional outcome measures like a TNETI or other outcome measure that you used, you'll want to obviously make sure you repeat the same outcome measure that was done at the initial evaluation or a previous assessment to demonstrate progress. When you're done with those, go back to your main discharge page, and then you can submit that form to QA, and then you're done.